Salesforce is updating its Health Cloud to consider social determinants of health. The new feature to Health Cloud could be used by medical providers and insurance companies alike to keep patients better informed. And Stephanie Condon joins us now with more on this. And Stephanie, let's start with social determinants, maybe some examples of those, what they're looking at, and why Salesforce thinks the information is so useful.
Yeah, absolutely, Karen. Social determinants are anything that's not really health related, but does impact your health. It could be where you live, if you live close to grocery stores, if you live close to transportation services. It could be your education status, your level of education. There are several factors that have an impact on how healthy your lifestyle is. And Salesforce is giving doctors and medical providers and payers a way to factor in that information when they're interacting with their patients and customers.
And Stephanie, talk a little bit about insurance companies. How could this information impact them as well?
Yeah, I think it's a little more self-evident the way doctors and medical providers would use it to determine what kind of care they can provide their patients, whether they need any follow-up services, like maybe an Uber ride to the doctor's office. But payers also really care about this information too. In fact, Salesforce says that payers, insurance companies, are the ones driving it because at the end of the day, your doctor may not care if you have a couple extra doctor's visits, but your insurance company does care because that obviously costs more if you have more follow-up visits. So an insurance company may want to know if you're an elderly patient, for instance, who needs a follow-up visit at your house to help you get to the doctor's office for your next follow-up visit. Whereas if you're a younger patient, they could provide you with a mobile app that would give you a notification when it's time to schedule your next visit. So for an insurance company, this kind of information can help them decide what kind of services to provide their customers to make sure that their care is provided in the most efficient way possible. And payers can include employers as well. They may want to provide their employees with information about preventive care and wellness, since obviously your employer is contributing to healthcare in many cases as well. And I can understand how this may give pause to people who are concerned about the kind of information their insurance companies may be collecting about them and how they're using that information, because insurance companies use complex analytics and a whole range of data to determine how risky procedures are, how expensive care will be, and how much they should charge their patients, and whether they should provide coverage at all for certain procedures. But Salesforce insists that this new health cloud, the social determinants, won't be used for those complex calculations. This is more about services on the front line, communicating directly with patients, as I mentioned, about getting them the extra care they need.
And Stephanie, also, this is, I don't think, any surprise, though, that a recent survey shows that the younger generations are expecting more digital interaction with their healthcare providers. So it does seem that Salesforce would be a natural fit to provide that information.
That's right. There is a survey from Accenture out this week showing that younger generations want more digital interaction from their healthcare providers. And so Salesforce does seem like a natural service company to provide that service because customer interactions aren't that different from patient interactions. So the Health Cloud is a natural way to provide that and provide those more modernized services for doctors to make sure their younger patients stay happy.
All right, Stephanie, we thank you so much for your insight, and you can check out Stephanie's full article on Salesforce's effort to update its health cloud. It's on ZDNet.